Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be talking about Silvasorb. But first, if you could hit that subscribe button, it would be greatly appreciated as it is a free way to help my channel grow. So let's get started. So Silvasorb, it is an ionic silver suspended in a hydrogel base. So it does release silver over a 3-day period. So indications for use. So we're going to be using this on wounds that have signs of infection, but also have small amounts of exudate. Because it is a hydrogel, it's going to add moisture to a wound. So if we already have a mild to moderate amount of exudate, it is going to increase that. So we want to make sure that it has either no exudate or very small amounts of exudate to be using, plus signs and symptoms of a clinical local infection. Okay, so use your nerds and stonies, make sure there is that infection, and then this would be a good part because we're not going to be using antimicrobials if there is no infection, okay? Because there is always some sort of tissue toxicity with antimicrobials or antiseptics. We want to make sure that we're using them appropriately. So if a wound doesn't have a clinical infection, we're using non-antimicrobial products because it will actually heal quicker. A lot of people like to think that, oh, let's just put an antimicrobial on and it will heal. No, we have specific things to heal specific wounds. No infection, we use a non-antimicrobial. So just keep that in mind. Look in the description. There is a video that I have posted before about nerds and stonies and how to determine infection. So check that out if you are unsure. So just some precautions. With this gel, we want to avoid putting electrodes or conductive gels in contact with silver products, okay? Contraindications, if somebody's allergic to silver, this has silver in it, so we wouldn't be using this. We're not going to be using it on wounds with moderate to large amounts of exudate. Silver products should not come in contact with oil-based products such as petroleum or paraffin. And silver products, if a client is undergoing an MRI or radiotherapy, we should not be using this product. Okay, so how do we apply this? So first we're going to start by cleansing the wound with some normal saline. And then you're going to remove the cap. There is a little tin foil that you need to remove. Now this is for multi-use, so just make sure that you are keeping it sterile. Use a sterile Q-tip to get some of the gel off of there because using it multiple times, we don't want to be adding bacteria to the wound. So cavity wounds, so we are going to spread the gel on a piece of appropriate packing and just insert it into the cavity. Now, if we actually have to pack the wound, we're going to take our gauze strips, our packing gauze, and you're going to moisten it with some sterile saline, and you're going to wring it out, and then you're going to apply a little layer of the Silvasorb gel onto that, okay? Then you're going to just lightly fluff that gauze into any undermining sinus tracts, just making sure that it's very lightly fluffed and not stuffed, because if we're stuffing it into a wound too much, it will cause added pressure and actually create a bigger hole. So we just want it lightly in that wound. And then just make sure that you do leave a tail so it can be easily seen and removed. And then you're just going to apply an appropriate cover dressing to maintain a moisture balanced wound. So to remove this dressing, you just simply remove the packing and you're going to just cleanse the wound to remove any remaining gel. Now the frequency of dressing change will depend on the amount of exudate. The silver gel does provide antimicrobial release for up to 3 days. So you can just change the cover dressing as needed, okay, without actually changing the packing. The expected outcome is that signs and symptoms of local infection are resolved within 2 weeks, okay? And then I have just added There's the different size tubes here, and then there is also a jar that you can get. So that's all I have for this video. I hope you did find it helpful for your daily practice. And if you haven't done so already, if you could please hit that subscribe button, it would mean the world to me. And I will catch you all in my next video. See you guys.